Under the anticoagulant therapies, we'll be discussing the various medical conditions. After we're done discussing the medical conditions, they will now come and talk about the drugs that can be used to treat those medical conditions. You understand? So the first medical condition under blood clotting disorders, of course, is the anticoagulants that are used in treating the blood clotting disorders. For the first condition we should be looking at, we'll be talking about what is known as the arterial thrombosis. Arterial thrombosis. Okay, so I have all the pictures here. We'll talk about it, and everything, including treatment. So arterial thrombosis, you just know that there's an abnormal clot, and this clot is inside an artery. Okay, when it's inside a vein, they call that a venous thrombosis. So it can quickly block the blood flow, or it will actually narrow the blood flow, thereby increasing the blood pressure of the body. Do you understand? So that's where cardiology comes in and all of that. So what is it? Arterial thrombosis is clot in the artery. Okay, of course, what is the use of the arteries in the body? They actually carry oxygen. So if there's anything blocking an artery or narrowing the passageway for blood in an artery, the thing is indirectly suffocating the body of oxygen. So arteries are actually high blood pressures. Clots can actually form. They are high pressured. They are high pressured. So that's why clots can actually form very fast. So what is dangerous? If there's a block in an artery, it can trigger a lot of things, like heart attacks, strokes, acute limb ischemia. Like if it occurs in the leg, it can now cut off the blood supply to the leg. So symptoms depend on location, but generally you can have a sudden pain. Then the nerves there could actually start being affected because they are lacking blood supply too. So you're having numbness. Sometimes the artery could actually get enlarged and also compress the nerves around there. So you can actually have numbness. Then there's weakness or coldness in the affected area. So what usually causes an arterial thrombosis? So most commonly is due to what? Fat buildup in the blood vessel. So they call that a fatty plaque buildup. So when the plaque ruptures, platelets rush in and form a clot. Okay, so risk factors. What can make you more easily for you to have this arterial thrombosis? If you smoke, if you take high cholesterols, high blood pressure, if you already have high blood pressures, if you are diabetic, if you have obesity, that's like you are overweight, or if you are very old. Do you understand? So they usually diagnose the arterial thrombosis because arteries are basically deeply buried in, not on top like the veins. Okay, you have to use imagings like ultrasound, CT scans, and MRI. Then also some blood tests to actually take it out. So treatments just have to do with antiplatelet drugs. So you are giving drugs that will stop platelets from coming together. We have anticoagulant drugs. You are basically giving drugs that will stop platelets from coming together. Alright, still the same thing. Thrombolytics, those ones are drugs that will break down platelets out that were already being formed. Do you understand? Then sometimes you can do surgeries where you can do surgery to break down the clots. Then also angioplasty just to restore the blood flow. So that's what we got for arterial thrombosis.